Medway CCG has been working with the local GPs using the Medway model to allow collaborative working to improve patient experience and health outcomes.
As a result of these collaborative efforts, we've developed several local care initiatives, and the series of videos that you're about to see highlight the key features, successes and achievements of each of these. We're doing a lot of work in the community to keep patients as well as possible, as close to home as possible.
One of the initiatives we've been working on is proactively working with patients that are in care homes.
Platters Farm Lodge here is a service that's jointly run by Stroud Park Foundation and Medway Council, and we provide care for people in terms of respite or rehabilitation. We were unable to get timely assistance from GPs because we have so many people who come here from so many different surgeries, and this service helps to overcome that problem. And the way it did that was to enable us to register everybody who comes here, which is up to 1,000 people a year, with one particular practice, and for them then to process those people as if they were either on holiday or part of that process.
We were very lucky to get involved in this project. Medway CCG had a vision that all care homes would have nominated one GP practice to give a seamless service to the patients within that home. We thought it was a very good idea for the patients and for GP practices.
All our records for people are kept on computer, and they're referred to either via the staff on a small handheld tablet or by some of the higher levels of staff, including the GPs, via a terminal. And this means that the GPs and other professionals who have access to our system can see everything that's happening with everybody here.
The CCG have kept a good lot of data. The patients coming in, the reduction in the 111 calls, the 999 calls. People want to be independent, they want to live in their home as long as possible, like we all do. The services that we offer alongside our colleagues in the care home in Platters enables patients to do that.
One of the things that we are doing is supporting patients with mental health needs in the community.
And one of the things we're very excited about is having a mental health nurse integrated within general practice.
I'm a primary care mental health nurse working across 11 different surgeries in the Rainham locality in Kent. Initially we were focusing on the annual physical health checks for mental health and dementia patients. Once that bit of work was completed, we moved on to working with patients within surgeries. We've had some really good feedback from GPs and patients alike, but from a surgery perspective they feel quite supported in having a specialist nurse in-house. So it's about avoiding referral to services, having specialist support there and then, or even just discussing complex patients and cases and getting more immediate support in place. We're at the Dementia Cafe in Parkwood. It runs twice a month. I've had several patients and carers that have come here to the Dementia Cafe. I think that it gives them a really good opportunity to discuss with other carers and other people who are suffering with dementia. One of the meetings in the month is for patients and carers to come together with professionals. So we have drop-in from various people such as myself, Carers First, Admiral nurses, we have the older persons community mental health team, Imago, which is a voluntary organisation, come along.
The professionals, the organisations that turn up, any information that I want about June's dementia or help that's needed, I can get it all from them. One-to-one conversations if I want them, which is often important.
You know, there's always someone to talk to. I just enjoy it. If I didn't, I wouldn't come.
We've made friends here, all in a similar position, all with partners with dementia.
It gives emotional support, it gives signposting, but also Even the social aspect of getting out of the house and having something else different within the week, reassurance from other people that there is stuff that can be done, they can still get out and engage with other people.
The integrated locality review team meetings have provided us with great opportunities to work with partners across health and social care.
This has provided an exciting opportunity for GPs to be supported when managing patients with chronic conditions and has shown to improve patient experience and health outcomes.
The integrated locality review team is a collaboration of a variety of services across Medway. So in the room today for our integrated locality review team is a social worker from Medway Council, our GP with extended role who is also our chair, a pharmacist, the ILR coordinator, consultant geriatrician from Medway Foundation Trust, advanced community practitioners from the community team, a student nurse, Imago navigator who is our social prescribing and wellbeing coordinator, and also a colleague from our mental health trust. We also have attendance from Kent Fire and Rescue Service and Ambulance Trust when appropriate. So traditionally, all of these organisations would have been discussing patients in isolation, fragmenting patient care and often duplicating actions. Here we are all meeting together with all our variety of databases and intelligence, which allows us to holistically discuss the patient and formulate a joint shared plan of care, which we then share with the patient. The integrated locality review teams meet in each of the primary care networks every week. We welcome referrals from a variety of sources for patients that may be frail with complex needs or require support from a multidisciplinary team. It's all about the service providers working together for the people of Medway, but also for each other.
As a voluntary sector charity, we support social initiatives, so people with social isolation, people who need form filling, people who need extra help, which is non-medical. It's where we can go in and support them, which adds really well to this team.
The outcome is one shared care plan for the patient, which we discuss with them and make sure we've addressed what matters to them.
Good leadership is essential for good clinical care.
Medway CCG has recognised this and has invested in a successful multi-professional leadership programme.
The leadership programme was created because there's a lot of change going on in primary care at the moment, and we felt that there was a real need to upskill individuals and give people the opportunity to develop themselves.
When I started the course I was assistant practice manager, and then throughout the time at the course I got promoted to practice manager. I think sometimes as a practice you can feel very isolated, you're kind of on your own with your GPs, so it's nice to have a little bit of interaction with other people in your locality.
It's a multi-professional course, so applications were open to practice managers, to GPs, to pharmacists, physician associates, nurses. So this course enables them to learn together, to work together, and hopefully bring change together.
It's been really good learning opportunity, and to reflect on, on myself and just see how others are as well.
The course covered a vast range of different subjects over the 9 months. I'd highly recommend the course.
As a group of people in Medway, we'll have a lot of change makers, and they will have the same kind of vision and the same kind of set of values that they can bring across the primary care landscape.
Medway CCG has been investing funding into strengthening primary care.
We've upskilled a lot of our receptionist staff to signpost patients to appropriate services within the community, and in some practices this has increased capacity by up to 2.5 hours a week.
Signposting is about ensuring patients get the most appropriate support so that they can receive the right care for the first time. Sometimes patients request an appointment with a GP when in fact another service could help them more efficiently within the community. These services can help patients that have social problems like isolation and loneliness. Sometimes patients need assistance and advice with form filling for benefits or housing, addiction problems and mental health issues, and once given the details they can actually refer themselves. The receptionists have been trained to triage and ask appropriate questions to enable them to direct patients to the right service for them. This enables patients to get the support they need quickly and allows GPs an opportunity to deal with other patients that may require more intensive medical support.
As a receptionist, we have a caring role. So when a patient calls, we ask the right questions, so then we can then direct the patient to the appropriate services.
So the wellbeing navigation service in primary care very much supports people with lots of kind of wider health needs and health challenges. So that could be navigating towards accessing some health services or social care services that they need to benefit from. But the social prescribing aspect of that is very much supporting them to access other services provided in the community that aren't necessarily health focused. So accessing community opportunities that could range from anything from singing groups to walking groups to talking groups, cookery groups, often provided by the voluntary and community sector, and social prescribing is very much the opportunity to bring healthcare colleagues and the sector together with our voluntary sector groups, and it'll only be to working together that we can very much support patients to be happier and healthier.